Welcome back, everybody. Next item 11 is our strategy for children and young people, and David Perdue, Executive Chief Nurse, is going to introduce this item.
Thank you, Cillian. It gives me great pleasure this afternoon to go through our strategy for children and young people, and I'm ably joined by Kath McAvoy-Carr and Heather Corlett, who runs their Children's Health and Wellbeing Network. It's been my great pleasure to lead children and young people services since joining the ICB, and I also lead children and young people services on behalf of NHS England for the North Eastern Yorkshire. We've got a clicker. Heather, next slide, Heather, please. So just in terms of context, in terms of better health and wellbeing for all, one of our four key in our 10-year integrated care strategy for the region is better health and wellbeing for all. And then there's a key focus in our joint forward plan, which sets out the NHS delivery aspects of our strategy. So obviously one of those is giving children and young people the best start in life. So in terms of giving children and young people the best start in life, it's enabling them to thrive, have great futures and improve lives for generations to come. And in terms of those outcomes, partnership working and integration is key to this. So it values the work that all our systems do for children and young people's health and well-being. And as part of their network, we have four not clinical leads, we have service leads. So we have people who lead the network, who work in the local authority, who work in the voluntary sector, who work within safeguarding and then in health as well. So I think it's really important that we have that breadth for children and also for education. So we cover the whole areas for children and young people. So in terms of our priorities, as I said earlier, mental health and wellbeing for children and young people is one of our key priorities for that. And we have a number of objectives that we want to achieve, and that's improve access to mental health support in line with national ambition, to reduce reliance on inpatient care, whilst improving the quality of inpatient care for those who need it, and then really importantly, skill children and young people and the workforce to support mental health and resilience. When we look at long-term conditions for children and young people, prevention and the effective management of long-term conditions are key to improving population health and the burden of ever-increasing demand for healthcare services. So there's some excellent transformational work that happens through the system, including epilepsy, diabetes, asthma. But integration centres to drive innovations for our most disadvantaged communities, including areas relevant to long-term conditions, is really, really important. Then we've got around complex and vulnerable and special educational needs and health inequalities and the impact of COVID. So the impact of COVID on our children and young people is well documented. The Core 20+5 is a national approach to reduce health inequalities. But specific consideration will be taken with the inclusion of young carers, inclusive health groups and other socially excluded groups. In terms of our objectives for this, it's equitable recovery of elective waiting for children and young people. And we focus a lot, like on adults. And today's board again showed there's a focus again on elective recovery, but we don't split that into children. And actually the children's waiting lists are growing rather than getting better. And deliver children and young people's Core 20+5 framework, and then meet our regulatory framework for good practice for SEND. And we've had a number of SEND inspections now in the region, and we are looking at how we share that practice across. And then we have the best start in life, so preschool needs and perinatal services. And that's really important around our objectives of connect, especially with place and local authority partners, and then initiatives that skill children, young people and the workforce to support the best start in life, preschool needs and perinatal mental health. So there are kind of key objectives for what we want to achieve. And this just shows you in terms of our populations across our places, with an average of 20% of our population being a child or young person. And I shall pass you on to Kath.
Thank you. Oh, I'm going to have to do my clicker myself. You have somebody to do that for you? No, don't worry. Just very quickly for myself, just to give you a little bit of a context of what the data is telling us for the North East. So children represent approximately 20% of our population. They are obviously 100% of the region's future health outcomes. And as we all know, deprivation in childhood is significantly impactful on outcomes for our children when they become adults. And poverty levels within our region are really significant, and we are almost top of the league tables that we don't want to be top of, and lots of local authorities and local areas are doing work around poverty and trying to understand or trying to mitigate against the impacts of poverty, which does include a regional poverty action plan, which is being led by Amanda Bailey, who is from the North East Child Poverty Commission. We know that school readiness by the end of reception is a key indicator as to children and young people's early years development, or children's early years in development, and it's a good indicator to evidence the impact of some of these challenges. And we also know that the promotion of health equity in childhood is absolutely essential, not just for moral reasons, but also for ensuring that as a society we have good economic and good economic growth in the future.
Good afternoon, Chairman, board members. Thank you on behalf of the Child Health and Wellbeing Network and its core team of staff and our rich network of part-time advisors that David's already highlighted for inviting us today so we can talk about delivering the Children and Young Persons Strategy. It's been a privilege and a passion for me to represent the network since 2018. That's actually 4 years before the publication of the strategy that David highlighted. So that meant that we were really well placed as a region to feed in the views from our network's 2,000 member reach in the development of the strategy to either validate its content and indeed encourage and lobby for it to be updated. Our early establishment is a real bonus, I think, for our region, but it was the foresight of Professor Chris Gray, the former ICB's medical director, and Ben Clark from the clinical networks, who presented the need for a continued focus on children in a gap between policy. And it secured the clinical leadership of Dr. Mike McKean to establish a network. You will, I'm sure, agree that it was the fabulous passion and vision from Mike as clinical lead that set us on a trajectory of partnership, delivery, and system representation, putting us squarely in the integration space, the sweet spot where magic happens. I highlight these points of consistency in relation to consistency between policy and funding and integration at the start of our talk today, because these elements, I believe, has enabled us to work within children and young people to enable them to flourish and provide assurances to you on our progress in the child health and wellbeing system to address the huge challenges they face. They in turn become the elements that we mustn't lose, and we must progress and implement the strategy with both consistency and integration in mind. But the first slide must be from the young people themselves, so I'll play a clip that was created during a young person's recent sprint for our Healthier Together programme, which you'll hear about later. It was made on their phone, unprompted, during the session. What a fun and energising piece of media. And what amazing skills. I've spoken about how I feel privileged leading the network that represents such vibrant and exciting young people. But they view the world differently to most of us in the room today, as their experience in life has been so different too. So to represent them and to look to improve the challenges that they face, as we know, is a huge responsibility. I'm cognizant of this, and it might not come as naturally to me, because I'm now 3 decades past when I could qualify as a young person myself. So the breadth of the child system is so wide. It includes health, local authority, voluntary sector professionals, and the delivery of multiple statutory responsibilities from different organisations. Education has a huge influence on our young people's lives and has a place of safety, security, learning, peer support, creative enabler, and one of the 4 areas around positive mental health, along with family, community, and the individual. Board members are aware of the importance of integrated working across the sectors to support children in unison. This vision acknowledges the benefit in working across organisational boundaries to enable young people to thrive. A system-wide network with its near 2,000 membership reflects the numerous professional groups and sectors all playing a vital role in our children's development. To ensure the voice of this system is heard and understood, the network has developed over 40 advisor roles to support them in health, voluntary sector, education, local authority, and roles focusing into integration and health inequalities and looked after children. Our vision was clear: to enable children to flourish through partnership, working with a clear ask to share good practice, connect them to the many experts across this broad system. The breadth and complexity, of course, does not stop with the professionals. The young people themselves are so different from birth through childhood, adolescence to young adult. They have different needs for service delivery and how we engage as well. At every interaction with children and young people, we need to consider the family too, which is where the board will be aware of the importance of a family lens in the wider work that it delivers. An example when looking at mental health, data developments and strategy. We've heard from David the key elements that focus is being given in the children and young person's best start in life goal. There were mental health, long-term conditions, health protection, vulnerability and complex needs, and preschool and perinatal. Well, we can instantly see here in our priorities wheel the alignment of the priorities that we developed in 2019 on the back of feedback from over 1,000 young people and professionals. Even pre-pandemic, mental health was the #1 priority highlighted by both the professionals and the young people. Number 2 for the professionals and 3 for the young people was poverty, a huge driver of inequalities, and this early focus has again enabled some innovations that have been developed further and of interest nationally. We also have the enablers and cross-cutting themes with our broader reach within the network. The pandemic had a massive impact on our young people, and none of us could have realised. So we revisited our very new priority wheel back in the early days and had a further 400 system responses. And with that, it asked that system support, the blue piece of pie there, that was an enabler, was brought up into the priorities, acknowledging the huge impact that family support has on children and young people. These priorities were system defined, and the network still focuses its work into these areas, which includes the key areas under the ICB's Joint Forward Views Best Start in Life section. I'd like to acknowledge the huge amount of work at place and across partners to deliver services that support our children and young people in the North East and North Cumbria in delivery. What I will share with members now is a focus on integration through our network, with some examples in relation to each of the top 10 priorities listed in the green on the right hand side. This is quite a stark quote, but necessary when considering our responsibilities to our young people. It speaks to the lost voice of children as a Cinderella service in an adult-dominated system. But I share this quote from Getting It Right for Children and Young People from 2010, which had 39 recommendations that I'm sure many of you have worked to deliver, and that Kath, as our DCS lead, noted the positive establishment of the safeguarding partnerships set up from this that are still in place. Whilst a lot of work has taken place since 2010 to climb the mountain of challenges we need to address, there have been further setbacks for our young people that board members are well cited on. The increase in mental health needs, poverty rates, impact and influence of social media, dangers of vaping and changes to mortality rates, and of course the impact of the pandemic. Children were seen as the collateral damage, affecting in particular mental health needs, loneliness and isolation, safeguarding, socialisation and development, speech and language delays. The mountain of challenges got higher, so the voice is our number one priority, both in the wider system as well as in the co-production and co-design sense. So it's from this starting point of disadvantage that, and the description of a Cinderella service could still be fitting in 2023, but we are working to address this both through NHS England, national colleagues, local executives and teams throughout our network by promoting the voice of young people in our work and our services. As the report from the COVID inquiry highlighted, it's important to listen to what children and young people have said about what they want from their childhoods and, where possible, incorporate their voices into decision-making processes. Board members will understand the real challenges to genuine involvement and co-production, augmented in our young people needing different methods for different stages of development and needing young person relevant methods to engage meaningfully. Colleagues in local authorities have a long history of effective youth voice, including Children in Care Council and Youth Parliament, and voluntary sector partners have fabulous in-reach services to reach our most underserved communities. What I can share with board is some of the evidence of our engagement. We have given it priority. We have a youth board process meeting ahead of our executive board and feeding their views directly into our board discussions. We have developed a network of over 50 groups registered to give a broader reach of youth organisations representative of the many communities and reaching across the system to local authority and voluntary sector settings. We're working to ensure our young people are seen and heard. We have 3 apprentices posts. Adam, our current apprentice, is shown in the middle of the picture here. Our youth board are developing a manifesto through visual arts to define what they would like from its relationship with our executive board. Using the relational toolkit work in partnership with Newcastle University. The 2 pictures on the right-hand side are from the other weekend, and we're very excited to see the outcome from that manifesto. Our improvement work has youth voice within it. For example, our asthma schools accreditation requires evidence of young persons' involvement in that process. The orange box on the side demonstrates what integration, or at the bottom, the impact of integration and how we've started to share the thread from the original importance and how it's demonstrated in the examples today. Mental health is the highest priority of all challenges identified by both professionals and young people. Here are some statistics identifying the challenges which board members discussed at your last meeting when your Executive Area Director highlighted the increased need and focused response to address it in this area. It is a known global issue and has a strong correlation to poverty. OHID, our Office for Health Improvements and Disparities, noted its importance for North East and North Cumbria in its recent Children and Young Persons Mental Health Data Pack, highlighting the important risk and protective factors, the individual, the child's family, the child's school and the community the child lives in. These factors are within our broad network community and incorporated in our approaches that I'll highlight. Finally, our poor mental health constitutes a substantial disease burden and drives further health and social inequalities in adulthood, which I'm sure you're all aware of. This important priority is clearly highlighted in the Joint Forward Plan and the strategy, and there is much work and focus into this area. Through integration, we have progressed work to complement the higher tiered support into lower level needs in education and training. Our youth mental health first aid model, funded through our NHS Charities Together bid, and which was a cross-system bid, and a model that support and train our voluntary sector colleagues already working into our most vulnerable young people. Again, working in partnership, access direct into those communities. The second important area is partnering through other networks. We've historically had executive level contribution from the Mental Health Clinical Network, and we work to develop new ways of working as their role changes. Another example of extremely successful ICB Always the Right Door event, where it was promoting trauma-informed work with children and young people. It had over 200 people in attendance and service user and family involvement at its heart to drive forward improvement in this critical area. As a network, we were able to advise and support and connect in that event. And I just want to share the collective actions that were agreed. The two most popular on that day was the need for more integrated teams and posts across the sectors to include voice of children and young people, families and carers, and that young people should lead and design services and be involved in the commissioning processes to decide how best money should be spent. As we try to bring together our mental health and physical health components that as a system we have siloed, I'm pleased to also highlight the important work to facilitate the mental health champions in acute settings and the work within our long-term conditions workstream progressing mental health initiatives. As we know, it's our children with long-term conditions that suffer from up to 4 times the levels of mental health need. The orange box again articulates some of the integration benefits of this work, including the community model impact direct to those most in need through our 11 youth mental health first aid instructors that have trained over 600 people, ranging from parents to support workers, teachers, health workers, including dentists and service users. I've spoken about the breadth of the system, which is integral to supporting children and young people, and our work to come together with partners to enable more children to thrive as the driving vision of our work to succeed. The other reference to breadth is the breadth of influences and the impact on our children's outcomes, the wider determinants of health. Poverty was the second highest priority that professionals and third highest for young people when they identified the priorities. The powers in the amazing system that identified the needs, as this was ahead of COVID and the devastating data that's been published since 2019. On that statistic, we can see the increase has now affected 51,000 additional children. That's 1,033 classes of 30 children more are living in poverty. Members will be aware of the correlation between deprivation, health and life expectancy, but that lifelong sentence has been shown to take root in early years. So the importance of impacting our children and families living in poverty and the barriers they encounter is vital. This shocking statistic could also illustrate the correlated increases in our current and future services, the cold home impact on respiratory services, and the Institute of Health Equity highlighted mental health as one of the key outcomes of living in a cold home. As a result of this, a priority of our integrated focus work into communities facing high levels of deprivation started in 2020 with a dialogue with our young people and families. We asked them, what are the barriers to coming to health services due to poverty? And this has led to a new innovation, poverty proofing in the health settings, with a voluntary sector partner, Children North East, and a finalist in the Health Service Journal 2022 as a most impactful project addressing health inequalities. We're pleased that this innovation is now in its 4th iteration in our region, and it's real evidence of the impact of integration and working together and some of the magic things that it can create. And as Kath mentioned earlier, both our network and more centrally our Director of Children's Services colleagues are involved in the emerging strategy and action plan for the North East, facilitated by North East Charities Commission and the Institute for Public Policy and Research.
Heather, sorry to interrupt you. You're on 3 out of 10, and I'm worried that we won't have any time for discussion. We'll have all the slides, and we can have a look at it. So if you could speed up a little bit, that'd be very helpful. Thank you.
Of course, I will. Thank you, and apologies. So here we can see some of the initiatives that have been delivered in relation to poverty, and this is through one of our partner networks, the Diabetes Network. In particular, the poverty proofing, that was the first time that it was tested out, but also diabetes access to technology that started with an introduction with local authority in the south of our patch and has led to, by the end of October 2023, 199 families have been provided with a repurposed mobile phone, laptop or SIM card to facilitate access to diabetes technology. Additional needs and vulnerability. There are clear-cut focus in our strategy and include the many groups of children and young people with both physical and mental health needs, and also from the inclusion groups that we've mentioned earlier. There's much work in the region taking place, in particular in relation to the neurodiversity pathway. And as a network, we've been able to feed into this work as well. So following on from the Mental Health Clinical Networks Foundation, then we have continued this important strand focusing on family needs and supported by Claire Devaney-Glynn and the parent lead and advisor to the ICB. This has been in recognition of the reach of the network and the ability to engage the required partners across the system. Colleagues may be aware of the various programmes of work that are undertaken across the system by partners with respect to diagnosis, triage pathway and the provision to support children and young people and families. Inequalities and access are threaded through multiple strands of our strategy, so important that they are recognised. And I also recall how the children and young people commented specifically on their ability to access services. Within the network, we have developed the national Core 20 +5 programme and given it a North East and North Cumbria lens. Through the support of the Healthier and Fairer programme, our health inequalities and migrant health advisor roles could continue, and we've developed a toolkit to support organisations in relation to health inequalities in children. It takes the national area of focus that is seen here in the middle, which looks at asthma, epilepsy, diabetes, oral health and mental health, but we overlay a North East and North Cumbria lens on the wider determinants that we've already know it's so hugely important to children. They're clearly listed in the bottom line of the visual and encapsulate the challenges we've highlighted to date. I'd just like to note on this slide that we've had 605 downloads of the toolkit with 350 related website activity. Apologies if the diagram in the orange looks like it's 3,500 downloads of the slide, of the framework. Strong Start in Life. It's the title of the fourth goal, but I love this quote because it defines that the first 5 years will actually shape the next 50. Many of our partners are already working into this key area, and I wanted to highlight one of our sharing good practice our sharing good practice toolkit that we have, which is a huddle, and we presented a huddle on baby boxes. These boxes are filled with great resources to support new families and give babies the best start in life, with some practical resources to make sure that poverty isn't a barrier to development, as well as supportive instructions and invitation to facilitate play. Families have been reported through the Children's Foundation that they felt more prepared for their baby's arrival with the support of the box, more supported, it made them feel happy, and the items in the box helped them bond with their baby. We also at that same huddle, shared the information on the Down Syndrome North East Baby Box and have since been associated with Theatre Hullabaloo Let's Play Baby Play Pack. Health promotion, the breadth of our system, I think highlights the importance of making every contact count, and I know as a board you often reference that. Through the network, we're developing an alliance to support the children and young person system, and so I felt it was important to highlight this as a key tool to enable the breadth of the system through a formal route of an alliance. I mentioned earlier that family support had been added since the pandemic and brought up into the priorities area. It is very important to the development of children and young people. And the Children's Commissioner reminds us that as a society we need to think family more. We have a fabulous initiative in the South where we have brought together our arts and creativity as a cross-cutting theme, and you'll see there it's been shortlisted for various awards. What this has done has brought a new sense through its partnership as a dance initiative, as well as offering family support, that those families are taken into a new creative environment, and then when the offer of family support is held up, they appear to engage in a different way to standard statutory services. And so we're looking at the research in this as to understanding why, but it's really interesting that through this creativity it brings a new element and a new rapport as a result can be created. Childhood illnesses, the long-term conditions we've highlighted throughout the work today, the importance on the long-term conditions, and here I've focused on our asthma work, and I can give assurances to the board on the progress of all the Children and Young Persons Transformation national asks. But we know that emergency admissions for asthma are largely preventable, so I'd like to share the work that we've been doing in the North East to address that. So building on the foundations of our North East Innovation Breathe by Dr Townsend at the Great North Children's Hospital, the funding of the NHS Transformation Programme has further developed and extended the reach of this work across our region through our education-based interventions delivered by our community and pharmacy advisors. We're also successfully delivering across the wider aspects of the programme. We've seen some great results and our focused energy directed into this important area. We have asthma advisors in schools, we've got BEAT Asthma Friendly Schools accreditation, we have schools policies that have been downloaded over 600 times, we have resources specific for schools and housing colleagues, and even a podcast that was the most downloaded in the national annual Ask About Asthma event. The fruits of the labour, the improved workforce confidence and competence with over 1,600 people taking up the training, 91% of whom are in education, and we're starting to see a reduction in hospital attendance based on September non-elective admissions. Although September is a known spike, there is a sustained year-on-year reduction since September 21, with a huge 65% reduction in hospital admissions for the same time frame. Whilst we cannot say this is solely attributable to this work, the progress made and the known fact that they are preventable admissions is hugely encouraging. One of the final initiatives I'll now mention is from Data and Digital. This quote highlights the high attendances we see in urgent emergency care for young people, especially those from deprived areas. What we have in the purple is a quote from a young mum in a project about how effective our Healthier Together initiative has been to assure patients the right course of actions and changing behaviours from attending A&A. The Healthier Together programme commenced in 2022 and has a strong national support and has been funded to date by the Transformation Programme and the North East and Yorkshire Digital Primary Care Fund. We work closely and we'd like to thank the ICB Executive Lead for Data and Digital for his support and strategic planning of this work. The funding's enabled a small core team to develop a North East and North Cumbria specific content on childhood pathways and guidance on how to support the unwell child. It includes access to other innovations such as the Newcastle Gateshead CCG Little Orange Book. We're pleased to say 5,500 children in our region are registered on the app, and they are from 300 different practices. We have nearly 30 practices signed up to receive the online consultation and are working with our ICB communication partners and primary care colleagues to encourage more practice take-up. The website continues to grow, and month on month, its peak of 45,000 hits during 1 month due to the Strep A outbreak last December illustrates both our ability to provide a responsive platform in times of need as a valued, trusted resource. Regular usage is about £12,000. I'd also like to note in this that the digital poverty position is a really important one that the website and the app are tackling through the facility Recite Me to translate and give accessibility tools. The app has an online function that can be used to check symptoms without Wi-Fi access. We're working with Healthier Together champions, and we've reached over 10,000 young people and families using voluntary sector organisations in the communities. We also have are supporting the production of hard copies versions of the Little Orange Book for the under 5s. This slide summarises some of the challenges highlighted today and the mitigations in place. An interesting publication looking at the history of integration in child health talks about the challenges of the oscillation of innovations and funding. I've demonstrated what we've built from the original ICS foresight to improve the consistency between policy and the benefits of working in the integration area. The first 5 years depict the next 50 years. So having the best start in life as one of the 4 goals is vital. Whilst there are a lot of work progressing with the increasing challenges, the mountain's getting larger for us to overcome. Thank you for your time today. I'm a general nurse with improvement and engagement expertise, but I'm powered by the most amazing team of 6, a fabulously experienced network of child health and wellbeing experts and unique young people that they serve. I hope you heard their voices and hard work. I leave you with the words of Sir Al Ainsley Green, a real advocate of our network. Thank you.
Well, thank you to Heather, Kath and David. Open it up now to comments and discussion. Maybe I could start. There's a formidable range of things that have been happening and are very, very impressive. But if you focus entirely for a minute on the outcomes that you want to improve, where are the early wins? So if we came back this time next year, where would you be confident of showing improvements in health outcomes, whether it's, or, I mean, numerous examples given, but whether it's something, if you like, largely, usually not a high priority like oral health, I know it is in your strategy, or control of diabetes, or some of the other things. Your early wins.
So I'll start. I think in terms of long-term conditions, I think the work that the network's done, especially around asthma outcomes and diabetes outcomes, are really impressive. I think they are ones we can see. I think from terms of the best start in life, we saw some really great information yesterday around school readiness, which is one of the outcomes that we can see. So we work really closely with public health. And so school readiness, we are above the curve in the North East, despite having real high poverty levels. So that's one of our outcome measures where I think we are really keen to progress, and the data is there. And so I think they're the kind of 3 for me, Liam, in terms of where we are.
Yeah, oh no, it's a good example because when I went round or nearly finished going round the ICP area chairs, Mark Fryer in Cumbria had that as one of his priorities, but he was having difficulty with it, a lot of difficulty. Is there anything we can step in and do to help him to boost his performance?
Yeah, absolutely. So I'll link in with him, because obviously the data that we have for public health is just for the North East. I know so we'll ensure that data's shown through to him as well.
Okay, thank you. Eileen.
Thank you, Chair. Firstly, thank you, Heather, for the great presentation. Just to say, I was there before the integrated system was there, as working with Mike McKean in the Great North Children's Research Community all of those years ago. So it's wonderful to see it develop. In terms of the early wins, I shared some information with you, Salim, a few weeks ago, in terms of some work we've done and published, which has followed children up from essentially birth up until 17 years of age. Now, a lot of people say poverty, what can we do about that, and why is it, is it an issue for our health system? What we've been able to show through longitudinal data is that you can see outcomes for children's mental health at age 14 and for their behavioural outcomes at 17. So you can actually sort of see real impacts of the first 50 days lasting for the rest of children's lives. And an early win is in supporting maternal mental health. So it is these children facing multiple adversities. There's poverty, they're in challenged housing, there's sometimes violence in the household, can be substance use and mental health difficulties in their parents, but usually the primary carer, which is often a mother. So I'm going back to the integrated women and girls health hubs and just thinking, bringing strategies together is where you find opportunities for synergy. And one of the areas to support children and young people is also to support maternal mental health in those early years for the children.
Thank you. Lisa.
I just wanted to say thank you to Heather for the presentation and to everybody for the work of the network, particularly on the emphasis of partnership working. I think it's a really good example of where differences between sectors have been used to support the advancement of shared objectives, and all of the work that you're doing is driven by the needs and the wishes of the children and young people, of our children and young people. I just think that's absolutely fantastic. Thank you.
Graham.
Thank you, Chairman. Heather, thank you very much for the really detailed update. Just a quick question that has sort of two elements. How do we compare our work with other integrated care systems? But I guess more importantly, given the great work that's happening here, are we sharing our work with other systems? Thank you.
Thank you, Graham. I think I'd like to say that as an ICS and with the development of the network ahead of the ICS's development themselves, we're really well placed, that we had a strong awareness in our region already. And yes, we have shared our practice indeed. When the new ICB executive leads were appointed, myself and Mike McKean did a presentation to them on one of their first meetings when all four of them came together across the North East and Yorkshire. So I think we do. The Healthier Together app and website nationally, that's been picked up and they're adopting that. We went the first in the country. It's been designed and developed from Southampton, but we are, I think, the second in the country to take on the app, and we've had discussions with national colleagues about our experiences because they're keen to spread it. So I think we have a lot to be proud about in the North East and North Cumbria, and a lot still to do. Thank you.
Thank you. David Chandler.
Yeah, thank you, Chair. I won't repeat any previous comments, but I totally support and agree. I was just wondering, in terms of the number 2 priority was around mental health, and just thinking about our performance figures that we were discussing earlier in the board meeting. In terms of one of the slides, there was a slide that talks about 85% of children finding support from families and friends and the value of first aid training. So my question is, given we do have a service development fund for mental health children and young people, and we have a mental health investment standard, so my question is, do you think we're putting enough money and do we have enough support or services in place around mental health first aid training for not just children, but for families as well? Would people know where to go to get that accredited training in the North East? Would be my main question. I'll do that.
Kath, do you want to take that?
Yes, I do. So the answer to that would be always, no, we're not putting enough money into that, as you would expect me to say. But there's a couple of issues for me. I think across the system, we're starting to see an increased pressure in relation to referrals coming through that relate to mental health challenges or mental health issues for our children and young people, and equally relate to mental health problems of parents as well, because there isn't enough out there to be able to deal with that massive influx. And Eileen, I was taking on board what you were saying there about actually maternal mental health. And in our family hubs, we are investing in maternal mental health support, because actually we recognise that this is a critical issue for us, particularly during pregnancy, but actually beyond pregnancy as well. So I think the wider that we can get those mental health champions or those first aid mental health champions, the better for everybody really, because actually it's about that earlier intervention which will stop that continual growth in the numbers of children and young people who are needing to access much more formal support. So yes is the answer to that question.
Yes, Heather, go on.
Thank you. And just to add to that, from the network's perspective, the Youth Mental Health First Aid project has come to a close with the funding that it had. We are actively seeking further funding, and we believe that the model that is directly into those communities that Kath's talking about and delivering to the families and the young people themselves is definitely a way forward and has a great impact.
Sarah.
Thank you, Cillian. Just a question for information and a bit of knowledge upskill for me. I don't know whether it's placed better at Catherine. But I was just wondering, obviously, when we talk about the adult world in terms of medical outcomes and evidence-based medicine, we attribute 85% of health outcomes to be wider social determinants of health, and only 15% is based on health service provision. Is that still the same for children? Do we have enough information to hold that understanding, or are we looking at something different?
Anything? Yeah. I never know whether you've got your... It's like being on Teams, the yellow hand, I can't tell what's happening without that. There we go.
I forgot to take it down, but I just wanted to return to Sarah. Firstly, to say, yes, indeed, and the information that I'm going to send to Kath, which I had shared with Chair, actually points to essentially wider and social determinants driving physical and mental health difficulties in children, not just in and around early life, but in their teens and into young adulthood. And then I also wanted to make a point about some of our local authorities who've recently been awarded funds to develop themselves as health determinants research collaborations. So Newcastle and Gateshead and South Tees, plus one more to be announced soon. This is where local authorities have got £5 million of investment to build their capacity and capability to drive evidence generation about what they do and what they're doing with partners, very much focused on wider and social determinants. So the inequality agenda is written right through that. So it's a bit of good news on top of lots of challenging stuff.
Well, we'll circulate Eileen's paper. Let's get that round to people. But we need to stop there. But thank you very, very much. It was a very interesting session, and we'll look forward to revisiting it. Claire, are there any questions submitted from members of the public?
We don't have any questions, Chair. However, I would like to just mention that we have received a letter from Keep Our NHS Public with regards to the process in which questions are asked at our board. We will respond to them directly and make sure that the response to their letter is put online.
Okay, thank you very much indeed. Is there any other business? If not, that concludes our meeting, and thank you everybody very much for your participation, and particularly to the presenters who gave us some really good food for thought and discussion. Thank you very much.